Good morning, everyone, and welcome to our panel discussion on resiliency among older adults. Our moderator is Dean Laura Belmonte from the College of Liberal Arts and Human Sciences, and she's having technical difficulties, but here she is.
Morning. There we go. I think we got it now. Okay. Thank you so much for joining us this morning. And I want to also give, he's not here yet, so I'm just going to continue here. I'm so honored to be able to convene this impressive panel of experts to explore the vital topic of promoting resiliency among older adults during the time of COVID-19. From the start of the pandemic, it became clear that older adults have an increased susceptibility to developing serious, even deadly complications from the virus. Although the pandemic has brought this vulnerable population to the forefront, our conversation today transcends the challenging time in which we currently live. Before I introduce our stellar panel, I want to let the audience know that our session is being recorded and will be accessible on the webpage at the conclusion. Now, if we were having, at a time when professional sports is at a bit of a standstill, we have managed to convene the all-star panel of rockstar gerontologists today, and it is my pleasure to be with such a powerhouse panel, all of whom have an affiliation with our renowned Center for Gerontology. I'll begin with Dr. Rosemary Bleasner, an alumni distinguished professor at Virginia Tech. Dr. Bleasner, would you please share some opening thoughts on the topic?
Thank you for the introduction, Dean Belmonte, and for inviting me to serve on this panel. I'll start by making a few comments about physical health and mental health. They both go hand in hand, and the best health practices for older adults are the same as for people of any age. It's important to eat well, to get some exercise, sleep sufficiently, deal with stress and the difficulties that might be coming along in ways that might be helpful to people. And so the best way to be resilient is to sustain health and well-being.
Thank you, Dr. Bleasner. Dr. Karen Roberto is a university distinguished professor at Virginia Tech. Dr. Roberto, would you please share an opening statement?
Thank you, Dean Belmonte. I'd like to talk just a bit about our family caregivers, who are really a very, very important part of the fabric of America's health, social, economic, and service systems. We know that about 42 million Americans are caring for persons aged 50 and older who may have physical, cognitive, or emotional needs. Family caregivers occur among all generations, race and ethnic groups, income and education levels, family types, gender identities, sexual orientations. We all probably either know or are playing the role of a family caregiver. Among caregivers, about 15 million families are providing care for a person with Alzheimer's disease. Most of these caregivers are wives and adult daughters who provide care for 4 or more years, which really supports what we see in our research. Caregiving is a long and winding road. There's no doubt that caregiving is stressful, but family caregivers are amazingly resilient. They often assume their caregiving roles without adequate understanding of the challenges they may face and without affordable services or supports in place to assist them with their daily tasks. And yet they develop routines and coping strategies that allow most of them to manage their day-to-day lives and the physical, financial, emotional, and relational stressors that are commonly when providing care for someone else. The challenges and uncertainties associated with COVID-19 raise new concerns in caregivers' already stressful lives. And just like most of us, they had come to rely on services in the community to help them provide their care for their loved one that became unavailable or reduced or offered in a new way in response to the need for social distancing. But these family caregivers persist, and they have found new ways of providing care and taking care of not only the person, the older person with Alzheimer's disease or other difficulties, but also caring for themselves. Thank you.
Thank you, Dr. Roberto. We'll now hear from Dr. Laura Sands, another professor in the Department of Human Development and Family Science. Dr. Sands, would you please share your thoughts?
Yeah, thank you, Dean Belmonte. Today I'll share some insights into older adults' experiences in the context of natural disasters, such as hurricanes, to illustrate how changes in our environment can be stressful for some older adults. Similar to disasters, the COVID-19 pandemic has resulted in decreased access to medical care and decreased access to help with daily tasks, both of which can impact older adults' health. Finally, I'll say a few words about long-term care facilities in the context of COVID-19.
Thank you. And now, finally, we turn to Dr. Pamela Tester, who is a professor and the director of the Center for Gerontology. Dr. Tester, would you please share your opening statement?
Thank you, Dean Belmonte. I'm very pleased to be with these colleagues today and talk a little bit about financial exploitation. Though adults can be exploited, and we have some studies at the national and state level that give us a glimpse into how often the mechanisms and successful interventions. Work at Virginia Tech and colleagues over 10 years ago told us that more than $3 billion were lost each year to financial exploitation. A one-year prevalence rate for financial exploitation tended to be 5.2% from work by Rana Cherno, also in about 2010. Up in the state of New York with colleagues there, we learned that financial abuse was the greatest abuse that was reported, with 41 per 1,000 individuals, but rates of reporting are probably mask a lot of what's really occurring, both in communities and facilities. Why? Low social support and exposure to previous traumatic events, clinical depression, and social and vulnerability and personal competence factors. But older adults are resilient and knowledgeable, and most know to be cautious, to stay organized, to stay informed, and stay alert. And there are great things going on the horizon, for many of which Virginia Tech is involved. The AARP Bank Safe Initiative with Dr. Tina Savla and me and AARP, we began to look at preventing financial exploitation with the banks. And it's a wonderful platform for frontline banking individuals to try to help older adults. In addition, a number of studies are being launched right at our own university, within our own college. The APS, Adult Protective Services Response to COVID, a national study, another national study on the exploitation by surrogate decision makers. Very soon, financial exploitation of older adults in the context of COVID with colleagues around the country, older adults' vulnerability to financial as well as research to look at white collar crimes. All those, Dean Belmonte, coming out of our college. So there's great work being and funded. Yes. So all those studies provide great hope. But I want to say the older adults, many are trained to understand and know these kinds of issues, and so there, many universities are helping them understand things. So while it occurs, there are many things we're doing to try to mitigate that problem.
Thank you, Dr. Tester. I'd like now to open the session more broadly so we could truly have a conversation. Perhaps Dr. Bleasner would like to speak to the challenges that older individuals face with social isolation with the added complication of a pandemic. And what tips would you suggest at a time of helping people that are older in our lives navigate this time of such extreme physical separation for so many families?
Well, we certainly know that people are finding it challenging because they want to have that face-to-face contact and they want to have the physical touching. That's, we know, so important to well-being. At the same time, this era of the pandemic and the kinds of technologies that we have available are helpful. So we know that the telephone has been around for a long, long time, and people use it, and making phone calls and checking in and arranging times to talk with friends and family are ways that are accessible to the vast majority of people. Now, those who have access to the internet could use Zoom or FaceTime or Skype or one of the other electronic virtual meeting technologies that we have available. And a lot of families are making use of those so that you can not only hear the voice, but see the people that are interacting with you. And then, of course, we have the possibility, it still exists, the postal service, so people could write letters and send cards. And I don't know about you, but we get very little mail except for junk mail. And I think it would be delightful to get a card or a letter from somebody to let them, let me know that they were caring about them. And I try to think about sending those out, especially during this time too. I think another way that people have been using while practicing social distancing, if it's possible, is to have a porch conversation between neighbors, or to have a driveway conversation. I know some people are standing at a distance and having a greeting that way, and that's very helpful too. There's actually research that shows that the kind of neighborhood that people live in, particularly is it perceived as being welcoming to people who are of all ages and people who might have certain kinds of limitations or not, makes a difference in how socially isolated people feel and how motivated they are to interact with others in their neighborhood. So while we can't promote a lot of gatherings at this time, we do know that research shows being open to the idea of interacting with a wide range of people does help to prevent social isolation from those who are maybe living alone and not having a lot of company. So let me stop there, and we'll come back in with other comments as the conversation goes on.
Thank
If
you.
I may, Rosemary, you brought up a good point about the interactions, and from a caregiver perspective, that becomes important as well, particularly for caregivers that are living with their relative. So that's sort of the good news. They're there. They can have that interaction. They can help the person with dementia, let's just use that as an example, to interact perhaps with other family members or to engage in different activities. And yet that caregiver really needs time for him or herself. And we've heard from the research that we're currently conducting that has been a struggle for many of our caregivers. So they have to be creative on ways that they find a little time off from the day-to-day caregiving, which has intensified somewhat, particularly for those with dementia, where the older person, him or herself, may really not understand the importance of washing their hands, social distancing, why they can't go outside any longer or for trips. And so it really becomes important that the caregiver not only cares for that person, engages them, and do many of the things that we've all been doing to maintain contact with others, but also to step back and take time for themselves.
Thank you, Karen.
We know that it's important for those caregivers or for individual older adults to have at least one person that they can confide in. It's not so much a matter if you have a lot of friends or a lot of family around you. It's not the quantity that counts. It's really the quality of the relationships and the quality of support that people are getting. And that idea of having one person that you know you can trust and that you can say anything to and be listened, be heard, be supported is so important for reducing feelings of being alone, you know, all by myself, whether I'm the caregiver or the care recipients. So.
I know in my own family right now, my father is 80 and is being treated for cancer and is about to go and have a procedure, and he's going to be in the hospital for 5 to 7 days by himself, and my mom can't come and family can't come. And I know there are many families across the United States who are dealing with not only the medical fallout of COVID, but also just the impact of trying to get our older loved ones to do their preventative health care, as well as trying to get access and continue to take care of chronic healthcare issues. And I wonder if you all have any insights or tips you'd like to share on how we might support our loved ones who are in this situation.
So Laura, why don't you take that one?
Yes, so both Tim, my husband, and I have parents in facilities to care for them in context of their health issues. And we're not able to be with them. Obviously, we can't travel to California, and we're not allowed in those facilities for safety reasons for the persons residing there. But I think the most important thing is keeping in contact with the person in, whether it be a hospital facility such as your father, Dean Belmonte, or in a long-term care facility. And there's a lot of options for doing that, not just a telephone, as Dr. Bleasner discussed, but also I've had one of the care providers in my father's care home hold up her phone, and I can FaceTime my father. And Dr. Roberto talked a lot about persons with dementia. And the issue is even in the context of not really truly understanding why I'm not in the room, he does hear my voice. And it's that sound of my voice that brings a smile to his face and assures him that we're there caring for him, whether not physically there, but certainly mentally there.
Of course, not all old people are residing in facilities. Only a small proportion is. Actually, most of them are living in their homes. So we've heard some news in the news that some people are reluctant to seek medical care, and we really want to point out that it's not necessarily a good idea. It's probably not a good idea at all to ignore any health symptoms that people might be having. And of course, physicians' offices, the advice is to call first, but the physicians' offices in our communities are maintaining very high standards of care with respect to prevention of transmission of the COVID-19 virus. And so we want to be sure that people understand it's really important to get any needed attention and not to worry about going for a doctor's visit if the doctor recommends that. We think that it's an important message to convey across the community of older adults.
And one of the positive things that has come out of the pandemic is really the increase in use of telehealth. And so people, not only the system has loosened up some of the regulation, and we certainly need to be respectful and mindful of privacy issues, but I know that a lot of families are using telehealth means to check in with their doctor when, particularly early on in the stay-at-home environment. But I think as this continues, it will give us another tool for caregivers in their box, particularly because oftentimes getting out is important for them and the person they're providing care for. It oftentimes is another stressor. And so to be able to really interact with healthcare providers in a meaningful way, and I think we're learning to do that in this mode. So if we can look at some of the bright side of that, I think that's one positive outcome that we are beginning to see.
I wonder if you all might share your thoughts on, in this time of a dual extreme challenge of both the pandemic and a really severe economic downturn, and how our media and political conversation about the elderly this year. And I'm sure that you've all had some thoughts on how that's been framed.
This is Laura Sands, and I'd like to address that in the context of older adults have been considered those who are 65 and older, and yet we know that that really is a gross generalization of who the population is that happens to be 65 and older. There are some very productive older persons 65 and older who are doing very well, and in fact are helping care for children of their sons and daughters in the context of them having to work while school or daycares are not operating. So we really need to be careful about considering this term older adult. What it's simply an age cutoff that is really relevant more to, you know, our Medicare system. Persons become eligible for Medicare at age 65. It's not because people suddenly lose their health at age 65. So I want to be really careful about talking about who really is in need. And Dr. Roberto talked about a very vulnerable population, those with dementia, and all of us have talked a little bit about persons with chronic conditions. But let's be careful. And all of these people are individuals with something to contribute, even for those who have difficulty communicating, either due to dementia or other disabilities. They all have something to contribute to our lives. So I do appreciate your respect, Dean Belmonte, that you're showing to all older adults.
The Gerontological Society of America has partnered with other organizations to create a really important initiative called Reframing Aging. And it's really about helping people to think about how are we addressing the needs of older adults, but in a way that isn't characterizing them as burdens on society and the other kinds of issues that Laura was referring to. My own personal sort of what I love to hate is language like, that's really catastrophic language, like the gray tsunami, like the, what's another one? I can't think of another one, but it's like the older people have, first of all, gone through a lot of other kinds of major historic events like the pandemic. And we even have heard in the news of people who survived the influenza epidemic of 1918 who are having another experience like that. So there's a lot of resilience already that many older people have. And so I think it's important that we think about using language that's inclusive of their strengths and abilities, even at the same time as we recognize that there are some people who are needing the kind of care that's provided in residential facilities or who have dementia. There's even actually been research on persons with dementia who can often tell their life stories in very interesting ways. And so this whole idea of helping people, instead of focusing on older people as problems and burdens in society, and that they're creating emergency situations in society, to sort of turn it around and to look at in what ways do they carry on the culture and the knowledge and the family lore and the historic perspective that can be really very useful to us as we're navigating through these new kinds of experiences like the pandemic.
And I think it's great. Some of the advertising and stories that we're hearing on the news have moved away from those kind of extreme examples to people's everyday lives. And how many of the food banks, as an example, you look around there, who's the volunteers, who's coordinating those for their communities. And it really is the older members in the communities. And so it isn't just the rate of an older individual who contributes. It's really the norm of many, many communities.
Probably nowhere does the victimizing older people come in than the abuse literature. And so it was particularly informative for me to go to a training session on reframing aging, so that, because it's easy for abuse, neglect, and exploitation to continue to regard old people as victims, as, you know, people acted upon, rather than persons who have strengths that can keep them from being abused, neglected, and exploited, as well as others. And so that whole idea of thinking of them as powerful individuals who can make decisions to spend the money they want to in particular ways we all on our little squares might not agree with, but they certainly can make decisions about how to spend their money and in whom to put their trust. And only a small minority of people might be persons who have experienced financial exploitation, but again, not necessarily using the victim language that we would have, so that, because that is very disempowering for them, as a matter of fact, and doesn't solve the problem.
Now, psychologically, I know it feels that the pandemic has been going on much longer than it has, but as a group of scholars who are very active in your national organizations and editing journals and publishing scholarship, I wonder if you have any preliminary thoughts on what some of the research questions that are arising that we will explore, given the paradigm shift in which we're all living.
As a current editor of one of the Gerontological Society of America's journals, what I can say is that we know little at this moment. And that's not surprising, because this pandemic is relatively recent, and because there are difficulties in collecting data from people right now that are not insurmountable, but at this point we're learning very little. And so most of our research is more epidemiologic, in other words, reporting trends. And then there's the bench research, but we know very little about older adults' experiences with COVID at this moment. And that's why it's so important for us not to generalize, but to ask our older adult, I call it my loved ones because they're my parents, ask their experiences directly of them. Say, how are you feeling about this? Are you afraid? Are you distressed by this? What is causing you concerns? And listen as compassionately as possible, without the idea of trying to fix it immediately. Just to listen to what their experiences are. Once we understand what their experiences are, then we can work out a solution together that is, one, possible, and two, mutually beneficial to not only the older adult, but also to those caring for the older adults. I think it's really important that right now, even in the context of not knowing who is and who is not experiencing burdens from the threat of COVID-19, we really need to be in really making effort to communicate with them about their needs.
And it changes. I mean, you alluded to that, Laura. So, early on, there's lots of questions about how do we communicate? What do we do? And so we as a society have sort of figured that part out. But now the questions are about the reopening and how to move forward with that. And what if a spike occurs? And so, I think all of us, and particularly families and caregivers, to be mindful and to be planful of the future. But I think the research, as Laura suggested, is really just very, very preliminary. We're not even sure the questions to ask at this point. But I would sense that there's will be long-term ramifications for individuals, families, and communities, and some of which I hope will be positive, and others where we'll really have to think about how do we best set up a situation that can be more supportive of individuals as we deal with the pandemic and future disasters, because this will not be the last one.
I think there are probably a lot of relationship questions to be asked in the future, and we can look to the work that's been done before, but people are just as they're raising questions about workplace changes and will we see workplace changes? Will we see more people working at home instead of in offices or on campuses? I think the same kinds of questions arise. Will people communicate with their family and friends, continue to do it in these electronic methods, or will it change the nature of the face-to-face communications that people have? But I do think that the power of this technology is showing us that we can do a lot to alleviate social distance, the kind of social distancing that exists when families live across the country from each other or in other around the world from each other, and can bring people together on sort of an even playing field. And so that, how does that shape intimate relationships that family members have with each other or that close friends have with each other, I think would be questions for the future.
Over in the world of abuse, neglect, and exploitation, I sent out a request for a COVID component to one of the studies we already had running. And it was to ask if they could give us their COVID data, which many of them are, many of the people in the study already are. And one of the questions that I got back on my email was, what's your hypothesis? And I thought, I don't know. I think that goes back with what Laura was saying. Could there be more financial exploitation? Well, the news would lead us to believe that. Could there be less of it because it's not being reported as often? Well, that could be true too, because if our data are reports, that's all we have. So I said to her, I said sorry about the dog. There's nothing that happens because, as a matter of fact, I don't know. It could be more, it could be less. We'll find out. I'm going to go on mute for just a minute.
I wonder if you might speculate on what, if any, changes in public policy might result in some of the ways that the pandemic has illuminated some very deeply entrenched economic and social and medical disparities in the country.
So we know that there are incredible disparities in the threat of COVID-19. We know that particularly, first of all, our data is limited to cases. I have to be real about that. The only data we have right now are cases that we know actually have COVID-19 because they were tested, and they're either the data are from testing, the data are from hospital data, or the data are from, unfortunately, mortality data. And so we have to be very real that I don't think we're capturing the entire population of persons who have acquired COVID and either didn't get tested, but struggled through with it and successfully so, or who struggled through with it and didn't get tested and then died of causes that were attributable to their chronic condition. So we have to be very careful about what conclusions we're making right now. That's the first thing. What are the policies we have to put in place? I've spent about 10 years doing research on older adults who need help with their daily activities. And in the context of a different kind of natural disaster, which was a hurricane, we found that older adults weren't getting the help they needed to complete their basic daily activities, their basic personal care activities like bathing, getting a meal on the table, doing household activities, doing laundry, changing their clothes. And we found that those services actually declined with undue proportion after a hurricane. That's not surprising. Roads were closed, services were difficult to come by. But the consequence of that was that older adults were at much higher risk for hospitalization after their hospitalization from an acute event, whether that acute event was from not being able to manage their own medications, whether the acute event was a fall. It's that's not important. The fact is they're at much higher risk of hospitalization. We know that anybody who doesn't have the care they need, and this has been going on in my research for about 20 years, that if you don't have the care you need, you're more likely to go to the hospital or the emergency department. So it's really critical from a policy point of view that we understand that preparedness is not just about not getting the disease, but preparedness is also about making sure that people are receiving the services they need to stay healthy, whether it be with their primary care provider addressing their chronic conditions, or whether it be with the agency that was providing services to your older adult in their home and now is no longer doing that because they don't have enough service providers to meet the needs of older adults. Then the family has to scramble and find means by which the older adult has the help they need to get through each day in the healthiest manner possible.
I think it's important as we think forward of policy is that the need for services, particularly home and community-based services for older adults, whether they're living alone and need some assistance or if they're relying on a caregiver, it's not to take over somebody else's role, a family member's role, but it's really to work in tandem with family members. And sometimes the way programs and the policies that drive these programs are set up, it's almost to the detriment when more informal help is there. It becomes expected, or you receive less because you have this caregiver without really understanding the lives of those caregivers and what they are giving up or how they're managing. So I think this sort of having people together now, and families perhaps, sharing more in the homes and so forth, it's really bringing to light all the different aspects of family life and where formal services really can come in, be helpful, and by no means replace, but really supplement the care that's being provided.
Rosemary or Pam, do you have anything to add?
Oops.
I will also say that I think that, and then again, this is what Laura said, we don't know. My suspicion is, as far as public policy is concerned on the health and well-being of older adults, particularly those who shouldn't be abused, neglected, or exploited, we'll probably find out different ways to intervene than we've ever thought. Karen talked about telehealth. Well, Adult Protective Services, a hallmark of it has been that it goes to do an in-home visit, right? Well, that's not been possible necessarily. And first responders respond differently. It could be that we find out ways to actually do that better. As far as the guardianship world, some of the court intervention, they're doing televised hearings where that was not possible before. And sometimes that is a great thing because it throws out older people from being in the court system. So some of these things, as they come on more often, will actually benefit older adults in tremendous ways.
And I think that's particularly true we see in our rural areas where it's oftentimes hard to get to the kind of the central area where services are, or there's just fewer of them. But then that raised the question of broadband. I'm sitting here in my office today because of living in a rural area that I love, but in doing these type of Zoom calls, I can't guarantee that it can work. And so I think another fallout of the pandemic is really emphasizing the need for broadband for all.
Just to follow up on your question, Dean Belmonte, while I say that not much research has been done, I think that what I'm finding is that many researchers have realigned the goals of their research to include the kinds of issues that have emerged in the context of COVID-19. So I believe within the next months and year, we'll be learning a lot more about the threat of COVID-19 to older adults' well-being and health. That said, it doesn't mean that it's only relevant to COVID-19, much like my research on disasters has informed what I think are priority areas to address in the context of COVID-19. I think it's very important for us to continue this research with COVID-19 so that we're prepared for the next disruption in healthcare services, in personal care services, in one's own life for the purpose of making sure that we can maintain the health and well-being of older adults.
Thank you. A lot of attention has been paid to the truly devastating impact of COVID on particular nursing homes across the country. And when we were preparing for this panel yesterday, I know that you had some strong thoughts on being very careful not to generalize our long-term care facilities as as all being the same in regard to how they might respond to the pandemic. And I'd really welcome your thoughts on that to share with our audience.
So, there's a lot of numbers floating around, and I want to be careful about numbers because, again, we don't have the data we need to really explain how many people are being affected by this. But what we're hearing in the press is that, COVID spreads rapidly through a nursing home and that it threatens the health and the lives of many in that nursing home. It's not that very many nursing homes. So that's the first thing I want to say. So if your older adult is in a nursing home, you really do want to be vigilant about asking the providers, what are the procedures you're using in your nursing home to keep my older adult healthy and not threatened by COVID. But most importantly, what we're finding is that in nursing homes, though, first of all, only about 4% of the population age 65 and older in a nursing home. So it's a very small percent of the population. And about half of deaths of those 65 and older are attributable to deaths that occurred in nursing homes. So those figures are very daunting. So when it does spread through a nursing home, it is very threatening to the people who live there. But it's not all nursing homes. So what can you do about this for your older adults? Talk to the director of nursing. How are they ensuring the health and well-being of your older adult? How are they following guidelines in a way that is both creative and yet still allows older adults those really critical aspects of human interaction and exercise, as Dr. Bleasner said, and nutrition. And so, for example, just because we called up the director of nursing at our families' nursing homes and asked them, what are you doing? Things like meals are delivered to rooms. There's no more congregate meals anymore. Of course, people aren't allowed in there that are from outside of the facility. Exercise is occurring in their hallways rather than in an exercise room. And they're occurring, pod by pod. And when I talk about a pod, these are people who live together in the same room, house, that have been living together for a month. And so they're at similar risks. They had, they know whether or not they've been outside and that sort of thing. So they're pushing forward these initiatives in nursing homes to make sure that older adults stay as healthy as possible, and yet we really don't know why COVID-19 spread so quickly in some nursing homes. We've got a lot of research to do on that.
I think it's been interesting, the different strategies that successful care facilities, whether it be nursing homes or assisted living facilities, are using. And I hope some of that continues as we come to grips with this pandemic. My mother lives in an assisted living who has become much more communicative in terms of the way they're communicating with the families across several states. She's in Pennsylvania. And then how they are also thinking about their staffing. And I think this is an important piece of the long-term care continuum. We know that it is hard work, and particularly the more frail individuals, the more care that they need. And oftentimes those people that we entrust the lives of our loved ones with really aren't provided opportunities for extended education and the pay that they well deserve. So I was really very pleased in this particular home where they've developed some strategies to incentivize people, but also to kind of maintain that stable workforce. So it's interesting, Laura, in my mother's case, she kept telling me about going down for her meals, and I'm thinking, I don't think so, because the letters are saying no. But in talking to the administrator and the nurse there, they said, well, in some cases, we have residents who really like their routine. So we've rearranged and reconfigured how we do meals for those that really need to come downstairs for just a little bit of time. So I think they're being very thoughtful and, really looking at the individuals, not just the collective.
Whenever there's an event that we're living through, it exposes chinks in a system. And this is not unlike any other time that we would have. Is right. We take a lot of our cues right now from what we're hearing, which is in the news. It's not science. But I think, and as Karen said, I think we will find that we'll get better practices in protection for infectious diseases than perhaps we have had. There will be a heightened effort now to address that particular area of providing care to others that perhaps everybody thought they had gotten control of that one because there were other things to address. So good. I'm not saying to have good things happen, in no way, but I'm just saying good results of this will be a heightened and better ways to control infectious diseases in places where people live more tightly together, and that will have a spillover effect to a lot of places.
We are very fortunate to have this incredible group of experts at our disposal, and I think it might be helpful to some of our audience if you might give us thoughts on some resources that people might avail themselves of if they're looking for guidance at this time.
Well, there are a lot of sources of information for general health practices from the National Institutes of Health Administration on National Institutes of Aging website. So they have many short tip sheets and guidelines about all different kinds of health practices. And there is a national caregivers resource. People can look up the care locator network of to find information about care sources of care in their communities, but also all of the communities have area agencies on aging, and they provide information and resources and guidelines for people to find in their own local communities. So then the AARP website has a lot of information. My colleagues can think of other sources, but there's an awful lot of online information that people can access if they have availability of a computer.
And it's really, we're very fortunate in the Commonwealth that we have the Senior Navigator that originated here that, again, set up very similar, put in your location, really provide you with a wealth of resources and contact information. But I would go back, particularly for older adults, to what Rosemary mentioned, which is the Area Agency on Aging. We have 20 plus of them throughout the Commonwealth, and really all states, almost all states have localized Area Agency on Aging, and they really are the go-to place. They may not be providing the service, the help that you need, but they can make recommendations on who to contact. And then finally, just a little bit more specific about dementia, the Alzheimer's Association too has a wealth of resources online to help the caregivers sort of think about that planning phase that we talked about, kind of some additional tips, lessons learned from other caregivers during this particular time, as well as online support groups. We've seen our mental health systems shift to online for individual and maybe family counseling. Well, support groups actually have started really opening up to more technology-based support groups, and we're seeing more and more of that, so that you can get that listening ear that Rosemary alluded to earlier, being so important, where somebody really understands the situation that you're in. They may not have all the answer, but knowing that you're not alone often helps.
And I really want to reiterate, for those with chronic conditions that require medical care, it's critical that you keep up with that care with you, that conversation with your care provider. In a study of diabetics, age 18 to 99, we found that those who didn't go to their medical appointments were more likely to go to the hospital within the next year. And so the bottom line is we have to take care of ourselves. We've lived in a very busy world, and it's kind of calmed down a bit because we're staying in place. But that doesn't mean that we can't converse with our healthcare provider about our chronic conditions. There's a lot that they can do over the phone or with telemedicine, including adjusting medications, understanding symptoms that you're having that are new, and understanding your concerns and being able to refer you to somebody who can address some of those concerns.
If
Pam?
legal, if legal or rights issues arise, many attorneys are doing the same thing that medical people are doing. So you can often contact them. You can contact adult protection through ways that you would do normally. And I guess I started making a list and I thought, oh gosh, it looks like a set of funders I've got. I don't want to go in that direction, but I also want to say there was great concern early on that releasing of checks from the Social Security Administration was going to ramp up a ton of financial exploitation. I don't know whether that occurred or not. Maybe we'll find out, maybe we won't. But the Social Security Administration and local departments of that also have produced some excellent information about protecting people during this particular time.
And Pam, I would add, just from some of the work that I've been doing with you, is that in the financial exploitation realm, it's really important for older adults, all of us actually, not just by age, that if we are approached in or experience a situation where a person is trying to take advantage of us, to really report that, whether that be to your local police or area agency on aging, but really, and I'm blanking, that's why I'm asking you, Pam, so like the Federal Trade Commission, who's keeping the list, so that you can kind of see what are the scams of the day, particularly around COVID.
We will compile these resources for our audience and make sure that we have a list at your disposal, and we will post that on the website so you have all of that in one place. Another thing I want to put a plug in for the College of Liberal Arts and Human Sciences, in that we'll soon be launching the Academy for Transdisciplinary Studies, and conversations I've had with Pam and others within the college have led me to believe that it's time for us to launch a really innovative new area studies minor on area studies, because we have an area here that encompasses all kinds of diversity: public policy, humanities, public health, cultural attitudes. And these are precisely the types of intersections that we really delve in the college. And I'm really quite thrilled about that coming forward as part of our larger curriculum. Rosemary, do you have any closing thoughts you'd like to wrap up for our panel here?
Thank you, Dean Belmonte. I think we've talked about some really important issues this morning. One of them is to recognize there's great diversity among the group of older adults. Some of them need a lot of assistance and support. Others are functioning quite well in the community and are really demonstrating the resilience that has carried them through life, through many other kinds of challenges. And we can help to promote and sustain that resilience by supporting them and making sure that they are socially engaged and that they are having someone to listen to them and some people to help them to have interesting activities, even if they are still living at home. I think that we know that family caregivers face many, many challenges when they're sometimes caring for more than one older adult who has physical limitations or who has dementia. They too are displaying a lot of resilience, but they too also need a lot of support. And asking how, what can I do to help, or even not even asking that question, but saying, I'll bring over dinner on Tuesday and leave it on your porch, can be so supportive to people that are really coping with a lot of difficult things. I think that we talked about the need for the public policy attention to the needs of older adults who are, and their families, who are facing difficulties that might have to do with access to all kinds of resources, healthcare, financial, food, housing, you know, the range of challenges that people face, especially when they're in low income situations and in living perhaps in certain areas, rural areas where they don't have as much access to as many resources as people in urban areas might have, that we need to have a much broader policy perspective on who is available and how can we support to provide the needs for the older adults in our communities. I think that we want to promote the best possible practices for self-care for people all through life, including older adults, so that they're taking care of their health, that they are taking care of their well-being. I've heard people talking about some things that they're doing that can be very helpful, I think, to others. One person I know is writing down something that she's grateful for every single day. Another person is making lists of fond memories from travels or other kinds of special events that she remembers. And so we can use our creativity this way to sustain our families and friends.
Thank you, Rosemary. And thanks to all of our panelists for this very wide-ranging and fascinating panel. And on behalf of the College of Liberal Arts and Human Sciences and the Virginia Tech Alumni Association, I thank all of our viewers for participating. We will post a video of this session on our webpage so you can be able to share it with friends, colleagues, and loved ones. And thank you all so much for joining us today.